Wow, we're having a lot of people join today. This is nice.
Like I said, my entire board of directors is here.
Good to know.
All of my bosses. I'm just looking at the attendees list.
Okay, people are coming in. I'm seeing a few familiar faces as well. Awesome. I think we can start.
Sure thing.
Okay. Hello, everyone, and welcome to TMF Week 2022. Good morning, good afternoon, and good evening, depending on where you are. Thank you for joining us today on our third day of TMF Week for a session, Developing an Efficient TMF Management Process with a Lean Clinical Team. My name is Amrutha Siva, and I work on the commercialization team here at Montreal. I'm incredibly excited and honored to be your host for today's session. Before we begin, I'd like to double check that everyone can see the presentation and that you can all hear me okay. Please write yes in the live chat to let me know if everything is working well. You can find the live chat button actually in the engagement section panel located on the side. I think people are able to hear me. Awesome. Awesome. People are able to hear me. Good to go. Before the fun begins, I'd like to go over a little housekeeping to ensure you know what to expect and that we're on the same page. All TMF Week sessions will be recorded and made available at the end of each day. Same goes for the slide decks. Each attendee will receive an attendance certificate for the entire TMF Week conference. You have to show off what you've learned, you know. Please feel free to use the Q&A section to submit questions at any given time. This is an interactive session, so get your questions in. Q&A section is also located actually in the engagement section panel located on the side. The Q&A session will take place at the end of the presentation. Also, we have a network lounge, so please feel free to network after each session or visit the Montreal booth. Okay, now that we've got the rules out of the way, I would like to introduce your speaker for the day today, Patrick Smith. Patrick Smith serves a dual role with Cymega Research. Through his responsibilities as clinical trial leader, Patrick helps ensure the operational success of the oncology trials by small and mid-sized U.S. biopharma companies Cymega attracts to Canada. As eTMF program specialist, Patrick oversees the Connect eTMF platform for all clinical studies at Cymega, including drafting eTMF-related SOPs and all eTMF-related templates. He has 15 years of clinical research experience, including his work with the Canadian Center Trials Group, large CROs, and Cymega. Patrick holds a Master of Science in Pathology and Molecular Medicine from Queen's University. Welcome, Patrick. I'll pass the baton over to you and let you share your presentation and begin it.
Thank you for, excuse me, thank you for the introduction.
Awesome.
Let's, share screen, and away we go.
Awesome.
Let me know when it's live.
It's live.
Hi, everyone. As mentioned, I'm Patrick Smith from Cymega Research, a Canadian oncology CRO, and I'm here to discuss with you the Cymega way of developing an efficient eTMF process with a small, lean clinical team. I see we have audience members here from large CROs that have established document processing departments. But what about smaller teams that have never managed an eTMF, perhaps from startup biotechs or smaller niche CROs like Cymega? I'll discuss with you how you can effectively use your existing lean team to keep your clinical studies eTMF consistently up to date, QC'd, and audit ready, because that's where everything needs to be double checked, based on our lessons learned using Montreal's Connect eTMF. system. Briefly, I'd like to introduce you to Cymega Research and our mission to bring cutting-edge oncology clinical trials to Canada, just so you know exactly how we work. Because our sponsors are small to mid-sized US biotechs that bring new and exciting treatments to Canadian patients, we work with about 50 Canadian oncology sites, which we track another 30 regional sites as their clinical research is spreading to more suburban areas. As most studies originate in the US and then expand outwards to include Canada, Cymega teams are very experienced in joining ongoing studies or expanding programs. So vendor teaming with global CROs is the norm as we manage the Canadian component of the study, including managing all aspects of the Canadian site participation, eTMF management, and Health Canada submissions on North American or global trials. So we have to be able to integrate seamlessly into the existing study architecture, including ongoing eTMFs, and have been growing our internal capacities, including introducing our organic eTMF capacity, Montreal's Connect, that we stood up in 2019. So today, I'd like to discuss 3 key aspects to building an effective eTMF in conjunction with a smaller, lean team. So number 1, understanding the steps a smaller organization can implement to maximize the utility of an eTMF. Identify background processes needed to stand up eTMFs and train users. And finally, to appreciate how to maintain the eTMF audit ready through intelligent use of available QC processes. So while this presentation is focused on showing how the Cymega teams were able to efficiently and effectively deploy and maintain study eTMFs, despite our teams being smaller in size, I believe that most of what I discussed can also be implemented into large study teams, regardless of your organizational size. Historically, when Cymega joined a study, it had already commenced in the US, and we were grafted onto the existing study architecture to manage the Canadian participating sites, and thus we use the existing study tools and systems. So our ClinOps teams would have to learn to use whatever eTMF was already in use for the study, whether it's Viva Vault or some other third-party use. It could be the sponsor's own internally managed eTMF, or which far more often, the global CRO, which managed the eTMF for the sponsor. So at the very least, our ClinOps teams became extremely good at learning new systems and eTMFs quickly. Typically, our access to these eTMF systems was via full upload / QC of documents arrangement, as we were responsible for Canadian site essential documents. Although less frequently, there were studies that our CRAs would be required to fully prepare a document and then transmit it via email to the document production and archival team at the other CRO for them to perform the upload. In which case, quality control for these documents was more challenging, and this just wasn't an ideal situation. So as the 2010s came to a close, and this is before COVID changed the world as we know it, we started to encounter pushback from some other CROs about granting access to their eTMF systems. Basically, they just didn't want us playing in the sandbox with them. Thus, the decision was made that Cymega would deploy our own eTMF system and function independently of any other organizations. So after an extensive search, our team chose to work with Montreal, another Canadian company, which is also based in Montreal, and their Connect system in 2019. So how do you prepare your lean team for use on an eTMF system? So I need to describe how our study teams are organized. At Cymega, our study teams are led by a clinical trial leader / project manager who's responsible for overseeing the study at the country level. This study lead project manager works with the sponsor, our client, to determine the requirements for document archival, works with the program specialist, more on that in a moment, to plan the study-specific eTMF plan for an intelligent setup of placeholders that aid CRAs with correct uploading and metadata indexing. CRAs are assigned based on the number of sites participating, and it can number from as little as 2 through to 5 or 6 on a study, depending on requirements. And this is what I mean by a lean team. There are no clinical trial assistants available to receive submitted site documents from the CRAs while on site and perform the mundane tasks of saving and uploading, naming, indexing, and QCing each and every study-related document from FDA 1572s through to multi-page local lab normal ranges, ensuring that all pages are present, well scanned, and legible. In addition, throughout the course of the life of a study, schedule reconciliations of the eTMF must be performed to ensure completeness of the study records prior to submission to the regulatory authorities overseeing the conduct of their study. Thus, to oversee the eTMF, in the absence of an entire department, we created the position of program specialist, an eTMF czar, if you will, who is a senior CTL that takes on the role of program specialist in addition to their daily activities. Thus, the program specialist performs all eTMF setup and onboarding activities, including the creation of the templates that the study-specific CTL will use to prepare for the study startup. So in order for the internal eTMF to function smoothly, the program specialist will need to draft and finalize, according to your company's standardized templates, a set of eTMF-related SOPs and work instructions that will guide the rest of the team downstream in order for all team members to work harmoniously throughout the life of the study. Further, having a dedicated training person will ensure that all team members receive a standardized level of training. So discussing HR issues related to staff retention is beyond the scope of today's talk. We're going to only focus on how a ClinOps team working together can bring about the cleanest, most complete eTMF on time. That said, choosing the right team can make or break a study. And this is especially true for smaller, lean teams. So all SciMega staff come from an oncology background, and our CRAs are all full-time, and they come from Canadian oncology sites. Thus, they have in-depth background knowledge on our sites and Canadian regulations, including archival requirements. Ongoing training programs and outstanding teamwork have led to consistently turnover for stable study teams and project continuity. So with this experience comes trust, because study teams that turn over rapidly on a smaller team creates a very oversized effect. If you lose 1 or 2 team members on a large team or in an entire department at a large company, this can be easily absorbed. However, if 1 or 2 staff members represents 33% of your entire team, this is significant. So it is on your internal policies and your HR department to ensure that your study members feel valued. They must buy in to being on your small team. Otherwise, this isn't going to work. So you have to work together fully as a team. Prior to any eTMF access, your lean team members should be well trained on the eTMF system itself, the SOPs and work instructions associated with your eTMF, as well as study-specific plans that govern the timelines and content of your eTMF. So when I worked for a large CRO as a CRA, when we collected new essential documents from the site, all we had to do was label the document with the study ID, the site ID, and what kind of document it was. And we just put this on a sticky note and ship it off in our monthly package to headquarters. And that was it. This was not a lean team. So back then, I had no access to the TMF as a CRA and no idea of the indexing and QC system in place behind the scenes, because there was an entire department dedicated just to doing that. And I didn't like it. I really didn't like dealing with TMFs. So nowadays, being involved with SciMega's eTMF is quite a 180 for my prior history. So smaller teams working with an eTMF need to be trained to perform all tasks effectively and efficiently, from the initial document completion review to the upload mechanisms, indexing, QC, and finally, efficiently performing reconciliations. This training program must be rigorously followed, not only to ensure that all study members are able to perform the required tasks, but also because training is a key item that auditors review during audits. Never give auditors a freebie, and this is something I come back to a few times. This cross-training in roles is also a requirement in smaller teams, as while CRAs are expected to maintain and upload site-specific essential documents, the CTL is expected to maintain country-specific documents, such as any Health Canada communications and approvals, or Canadian-specific study plans that are filed in the eTMF, such as the Canadian-specific clinical monitoring plan. Due to the policy of 2 pairs of eyeballs required to complete QC checks, there's no set expectation that only CRAs will upload and only CTLs will perform QC checks prior to publishing. CRAs are able to verify documents that CTLs upload and vice versa. So on a small team, teamwork and cross-functionality is absolutely required. And teamwork is an idea that I'm going to harp on the entire presentation. Now, while not eTMF specific, I do want to reiterate on company and team turnover, because efficient, small, lean teams can, in my opinion, only really function if the corporate turnover is very small. As we rely on each other to a higher degree than do large companies with multiple departments, the ability to train and keep teammates is crucial. So if you're from a small team architecture, listening to my presentation, and you're constantly experiencing CRA project manager turnover, it will be much harder to apply any of my lessons learned. So use that as a placeholder, as a key requirement. If you are having a lot of turnover, you need to look at the cause and effect of what this is occurring and fix it. So what are the background processes that are required for these lean teams to be efficient? So when we speak with potential clients, quite often the same key concerns are voiced about expanding to Canada. So what are the startup timelines? How fast can Canadian sites get up and running? And how robust are your processes and SOPs? What services are offered? Do you manage an eTMF? How robust are your eTMF SOPs and your eTMF processes? Team stability. How does your CRO, which is basically the study representative at sites, conduct themselves on your behalf while ensuring that the study is managed expertly? And how are internal trainings conducted? How does the team know exactly what needs to be done? And audit readiness, because quite often that study is registrational. It will be presented to the FDA before being marketed. How are the essential documents maintained? This is absolutely a critical step. So we'll explore these concerns, and I'll demonstrate that smaller lean teams can maintain your eTMF extremely well, and in fact can be an excellent option moving forward. So the past 2 years have truly been unprecedented due to the effects of COVID. And frankly, I'm tired of the term unprecedented. It's been a tough 2 years, I'm sure, for a lot of people. However, for oncology,
Patrick?
Yes.
Apologies. I think there's some background noise from the mic.
Oh, okay. I'll just give it a move. Hopefully
Sure.
that's better.
No worries.
Sorry about that.
Awesome.
However, for oncology patients and patients in general, delays to treatment are unacceptable, and the research into new and improved treatments must continue. So activating an eTMF during the past 2 years has presented new issues that needed nimble and agile study teams working hand in hand with research site teams. So reviewing our KPIs from the first 3 eTMFs deployed by Cymega during COVID, we are excited to see that efforts to meet the COVID challenges head-on were successful. For example, our very first eTMF to deploy, which is study 1 on my slide, only took 24 business days from sponsor go to deployment. And this includes preparing all study eTMF plans, finalizing a naming convention for the very first time, and training all staff on the new Connect system. Subsequently, we implemented a rescue study requiring the migration of nearly 2,000 documents into Connect with the very substantial help of Munchram's team. So thank you, Munchram. This slowed down the deployment slightly, but overall an outstanding effort. Now those documents then needed to be QC'd for any migration hiccups, which was accomplished by a Cymega team member. Taking these and other lessons to heart, our current record holder took us only 13 days, over Christmas no less, from the time the sponsor requested us to maintain a Canadian eTMF to deployment. So think about that. So whenever a large CRO says, oh, it's going to take us months to deploy this, a small team can do it in about 2 weeks. Further, these data points show that a well-trained team can begin to upload and function in the system immediately, which is also a function of being well-trained. So once the study teams are trained and ready to begin uploads and performing QC in the shortest possible time. So I think we can definitely say having a small and lean team is not a slowdown to being efficient. So tools. Without tools, we may as well be running around naked. Most CROs maintain templates for study plans. It promotes standardization across studies and teams, minimizing spaces where errors can be made by less experienced team members. Now, this isn't a feature unique to small teams. What is important for small teams is that the templates must be prepared in a manner that promotes ease of use and time efficiency. As much pre-preparedness as possible must be baked into the template. Smaller teams often are able to bring a more personal touch to intercompany relations. So by working in close contact with sponsor leads, the study plan drafts and related document review timelines may be cut down to a bare minimum, enhancing efficiency in deploying your eTMF. So circling back to the standardization of templates and processes to prepare for an eTMF deployment, the use of an eTMF czar, as I mentioned earlier, to guide the study lead in applying the applicable tools to your eTMF was something that we found to be immensely helpful, as lessons learned during one deployment or eTMF usage could more easily be disseminated to other study teams. I was fortunate enough to be asked to function as Symega's eTMF project specialist, overseeing our implementation of the system and ongoing use of Connect. I'm able to work directly with the study leads and our ClinOps director to update templates and training systems as we require once new procedures are decided upon. So templates for eTMF plans, management plans that is, must be written in a manner that is not only easily used, but offers selectable options to the study leads, including leading questions that cover the most common occurrences associated with the eTMF. So easily selectable texts and options via color coding and highlighted instructions headers work together to bring clarity to instructions and study requirements. Teams can only function as well as their instructions, so our templates are developed so the study leads are able to efficiently communicate expectations to the rest of the team.
Patrick,
yes.
Apologies to cut you. I think your shirt or something is rubbing the mic, which
okay.
may be causing the disturbance.
Sorry about that.
No problem.
So quality instructions and clear expectations combined with a well-trained and highly motivated team are the basis for quality in any domain, but especially in the highly detailed world of document archival. So the most commonly used templates that we have are the eTMF management plan, the structure and content plan, which outlines all documents that Symega is responsible for maintaining in the Canadian-specific eTMF, as well as the Symega Standard Naming Convention, which details in minute detail the naming and indexing of all documents expected to be sent to the eTMF. So nothing is left to chance or misrepresentation. There's an old saying, garbage in, garbage out. The eTMF is the official record of the clinical study for regulatory authorities, be it the FDA or Health Canada or the EU. You must be able to present the eTMF as a robust and complete package that is clean. Always remember that auditors and inspectors may know nothing about the specific indication or disease being investigated, but they sure can review an eTMF inventory log for a missing medical license. At the beginning of our entry into the eTMF world, we predicted that in order to maintain an eTMF that was ultra clean and audit ready at all times, a series of QC steps should be put into place to ensure that each document was thoroughly reviewed and that no garbage would be present in the final published record center. Now, this was initially based on our prior experience with large CRO departments and teams, but in reality, we were working with small teams. These small teams could be very small indeed, to the point that processes were revised to only require one CTL and one CRA. So what did this initial document workflow look like? And this is it. So after the initial document workflow QC process implemented by Symega, we had the onboarding, when we onboarded Connect as our eTMF. It was decided upon with the greatest of intentions, and it failed miserably. I won't lie, this process created a document review monster for our teams. So implementing the inbound QC to review the actual PDF document, then a peer review, then a management review, followed by a regulatory review, before finishing with a post-approval QC. So as you can see, there are more steps involved than there are team members on the typical study team. So this doesn't make sense from an efficiency perspective. The result was that every member of the team received email notifications for each step of the pathway, and efforts were not just duplicated, but quite often in quadruple. So QC efforts bogged down and documents were being QC'd in acceptable timeframes. They were just being lost. I've shown that it's taken longer to QC a document using this review workflow, but did this make the initial eTMF uploads cleaner? Well, this is actually quite unlikely, as documents would get stuck in the pathway, being bounced back and forth prior to being published. It was certainly inefficient, which is something smaller teams just cannot afford. So that was our initial workflow process and how it didn't work for our teams. So we went back to the drawing board to determine what actually needs to happen to a document prior to being published and being ready for archiving. So what are the visual checks that need to be done? Is the document legible? Are all pages present? Are they oriented in the correct fashion? Is the pagination correct? Are the signatures legible and present in the PDF version for e-signatures? Are the indexing metadata correct? And is the document filed correctly? Well, using Connect, this equates to using the inbound QC workflow only, as you can see on the left side of our workflow process. Other systems will have their own unique document review pathway, which will require a separate discussion all on its own. However, the key takeaway from this experience is that a smaller team must make the determination of what needs to be QC'd and apply the system processes inherent to your eTMF for choice. That makes closely follow this requirement. Additional review steps, simply for the sake of having the review steps, add an unmanageable burden to smaller teams. So identify what needs to be reviewed and then work with the system you have to accomplish this with the fewest steps possible. So following the determination that our systems would utilize only the inbound QC pathway with the limitations of essentially a one and done QC of a document prior to publishing, what are the downstream repercussions that your smaller team must absorb? Nothing is free in this world. This is essentially the increased risk of a document that contains errors being published. This could be due to an oversight where the reviewer missed a document error or erroneous metadata. It can also result from an incorrect click on approve instead of rejecting the document being reviewed. Because once approved, the document is directly sent to the Record Center for final filing. And once final filed, very little metadata can be amended. The document artifacts can be deleted by someone with the correct permission setting. In order to maintain a transparent and rigorous process, SciMega implemented director-level approval requirements for deleting published documents from the eTMF. All documents to be deleted require that the program specialist document the cause and corrective action for each deletion request and obtain the sign-off from both our QA and ClinOps directors. All deletions are tracked and recorded. So what are the metrics associated with this workflow process? Current deletion ratios are tracked through the defined process at SciMega under the oversight of the program specialists. So how did our selected 3 lean teams perform from a QC standpoint? Well, from a nearly 6,500 document 3-study example, only 36 documents total have ever required deletion due to errors not caught during publishing, which is pretty good. Maintenance of KPIs, including deletion requests, demonstrated how our teams were performing. As you can see in this table, there was only one outlier regarding the rated deletions in comparison to all other studies. This was study 3. Now, study 3 demonstrates a significantly higher deletion rate. And this is because I count every document to be deleted. And when I drilled down further into these metrics, there were 2 cases where batches of documents, 14 and 11 respectively, were erroneously published into the eTMF due to a naming convention misunderstanding. Removing these outliers results in an overall rate of only 0.17%, a much less rate. This review process allowed our teams to upgrade their training to minimize introduced errors into the eTMF. Everyone must always constantly learn from their mistakes. This demonstrates that a properly trained, smaller team using a single point of review during QC is able to produce an exceptionally clean eTMF. So with less review steps and usage, maintenance of checks and balances, including proper oversight, are key. So let's discuss eTMF oversight next. Track everything. Pre-populated templates listing the base expected documents. All set?
Go.
Sorry for for that, everyone. I was essentially done the presentation anyways, so we can move right into some questions if you like. I want to thank Montreal for the opportunity to speak today, and thank everyone for attending my talk. So please shoot for any questions.
Awesome. Thank you, Patrick. It was a very insightful presentation. I think, we do have a lot of questions from the audience. So for the next 10 to 15 minutes, we'll be having a Q&A session.
Great.
So I'm going to open it. Okay. So.
Hi, and Patrick, can you just remove yourself from the green room? Just click the red button because you're sharing your screen, so we can't actually put up our...
Oh, yeah, stop sharing.
Perfect, thank you very much.
So there is a question from Fran. She has asked that, Patrick, how do you deal with completeness?
Completeness. So that is a multi-step process. Primarily, we use both placeholders in the eTMF as well as our ISF tracker, the manual tracker. So the eTMF placeholders, if you're not familiar, fire based on the milestones reached in the eTMF. So if your site A reaches ongoing status, the placeholders for monitoring visit reports will fire, reminding you that you're expected to upload monitoring visit reports at that particular stage. So that's one in-system manner of maintaining completeness, and that's set through the eTMF specific file plan. Further on the manual trackers, our trackers that I showed you in the presentation, we pre-populate, say, the group of medical licenses for 2020, and then we'll have pre-populated medical licenses for 2023. So while we won't have collected the medical licenses for 2023 because it hasn't happened yet, they're already there in the the eTMF tracker manual that we use, the manual tracker that we use. So those are the two main items that we use. And then, as mentioned, there's the structure and content document, which outlines every single document that should be collected in our eTMFs.
Okay, thank you so much for sharing that. So the second question is from Rob. How do you manage the overall study TMF? Are you keeping additional copies of documents in your system, or are you accessing the main CRO system for core study level documents?
Yes, so that's a multi-point question. So we do keep a working system, basically shared drive, behind a VPN and password protected. And that is where documents can be accessed by our study teams easily without risk of anything ever going wrong with an eTMF. So it's an independent system from the eTMF itself. When it comes to study level plans above the level of Canada, because we only deal with our TMF only deals with Canadian specific documents. So we don't file the protocol in general in that level of document in the eTMF. But that would be in the global eTMF, and we have to have an arrangement with the sponsor as well as the other eTMF holder with what documents are going to be held. And so study level documents in general are always in the global eTMF because there's multiple countries probably being managed by a very large CRO. And so those documents are sent to us, and we do maintain copies in our working shared drives, but we don't file them in eTMF because you don't want to have duplications between eTMFs, because you can either merge the eTMFs at the end or simply export them. And then the sponsor can maintain, following the termination of the study, as for their own archival purposes. Hope that answers the question.
Awesome. Thank you so much. So we do have a lot of questions about oversight. So can you speak to how you handle oversight?
Yeah, so it's a multi-layer system, basically. So the CTLs oversee the individual ETMFs, performing the schedule reconciliations, overseeing QC, ensuring that all documents collected during a monitoring visit report and in the interim time between monitoring visit reports are uploaded on a timely manner, and this is all tracked. And then the project specialist, myself, is able to help and for any troubleshooting. And then the study leads also have to report up to our director of ClinOps on a monthly basis on timeliness, anytime that when the last series of documents were uploaded, so that timeliness is tracked. And then further, if any timelines are broken, this is also reported to our QA director.
Okay, thank you so much. That was a perfect answer, Patrick. I believe that we're getting close to the end of our time together. All good things must come to an end. Thank you once more, Patrick. The presentation was wonderful. It was so informative to everyone. We're really sorry that we couldn't get to all answers, but you can always ask the questions and reach out to us at marketing@montream.com. So we do have a networking lounge, so don't miss out on the next upcoming session. Become a better storyteller and implement a TMF, maturity and process model, which will take place at 11 a.m. EST. Now it's time to network. Head over to the lounge or virtual booth, chat with your peers and colleagues, meet new people, or you can just simply chill and have a great time. Thank you for joining everyone. Have a wonderful day today, and we welcome you to the future sessions as well.
Thank you.
Thank you so much.